Well, June marks Men's Health Month, a time to highlight men's physical and mental health and overall well-being. We're joined by Touro's Chief Nursing Officer, Kodi Craft, to explain how men can prioritize their health this month and throughout the year. Good morning.
Good morning.
Thank you so much for joining us. This is such an important topic as we head into the Father's Day weekend. We want our dads to take care of themselves. What is it about men that they are, stereotypically don't take care of their mental health or their physical health by checking in with the doctor?
Thank you for addressing this very important topic. Historically, men do not do a good job of taking care of ourselves. We tend to wait to when things start to go wrong or we're not feeling well before we even try to seek out medical attention. What we should be doing is looking at prevention. And how do we prevent this from happening or that from happening? And that usually comes from getting a primary care physician who can help assist and guide you through that process. And definitely at LCMC Health in Touro, we want men to seize this opportunity and take advantage of getting that type of help.
And this is a month where we're trying to raise awareness about that. When we talk about men prioritizing their health, what does that look like? It may sound like a time-consuming thing or maybe an overwhelming sort of thing, but it doesn't have to be. What does it look like to prioritize your health?
Prioritizing your health primarily would look like getting that appointment with a primary care physician, keeping up with that annual physical exam so we know what's to come.
Which is just once a year.
Which is once a year, but within that, we come across milestones and certain ages in which we have to do specific screenings. For example, we can do prostate screenings when you reach a certain age, cancer and colon screenings, testicular cancer. So between those ages of 40 to 50, that's when we really start to see those screenings start to take place. And that can help with the prevention of anything that can take place and catch us off guard.
Which will keep Dad with us longer, keep him taking care of the family, and allow everybody to enjoy time with him for longer. So make sure that you are taking care of those annual physical exams and getting those extra tests, like you said, as they come up. What about Dad's mental health? What about men's mental health? This is something that I really feel like is not prioritized or talked about enough, maybe getting a little better these days.
Right. You hit the nail on the head. Men will get together, we'll talk about that run that Alvin Kamara had on Sunday, or that big dunk that Zion had last night, but we don't talk about how we feel, or our feelings that we're having in the moment. And that's a thing that we need to get used to, because there's such a stigma around men talking about their feelings. You know, we've always been taught to be tough, suck it up. We'll do better next time. Don't worry about that. But we have to consider our feelings and know that there's an issue when it's present. So a lot of times depression will present itself differently in men than it does women. So for men, you may become angry easily, you become frustrated. And women, they're a little bit more withdrawn, but with men, you just see a different type of vibe with them. You know,
which can affect the people around you. So
exactly,
if your concern is kind of being there and being supportive of your family and things like that, you need to make sure you're taking care of yourself first.
Yes.
So I really appreciate you coming on and talking about that, because you're right. We need our dads to take care of themselves so they can keep taking care of everyone else.
Yes.
All right. If you want more information, you can go to lcmchealth.org. We appreciate you coming on.
Thank you.